Differential diagnosis of congenital cystic lesions of the neck with its recognized pattern on clinical examination has been shown along with the discussion of its sites of origin. The top and the commonest is the thyroglossal duct cyst. It can be seen on the anterior cervical triangle and close to the midline between the foramen cecum and the thyroid isthmus, and you can appreciate this thyroglossal duct cyst on this image. It can be confirmed on the ultrasound imaging, CT scan. These two modalities can be used to confirm the thyroglossal duct cyst. The second one is lymphangioma or cystic hygroma. Mostly it arises from the posterior cervical triangle, occasionally in floor of mouth and tongue. In the above image, you can appreciate that this cystic hygroma is arising from the lateral aspect of the cervical triangle. The best modality is the ultrasound. During the antenatal examination, if you do the ultrasound, you can pick in the fetus having cystic hygroma. After that, the CT scan is the modality which will be used to confirm the internal contents of the cystic hygroma. On the third differential, it's a second brachial cleft cyst. Here on this above image, you can appreciate that this is second brachial cleft cyst, so it is easily recognizable on the clinical scenario, and clinically you can appreciate this. The main point of presentation would be that it would be near to the angle of mandible, and the second pattern would be that anterior to the sternocleidomastoid muscle. Here on this image, you can appreciate that the sternocleidomastoid muscle is clearly visible. By the time when you ask the patient to just look towards the side, so you can appreciate that the sternocleidomastoid muscle would be visible, and this brachial cleft cyst would be anterior to the sternocleidomastoid muscles. Differential for the congenital cystic lesions of the neck include brachial cleft fistula, or brachial fistula in short word you can call it. Here on this image, you can appreciate that brachial fistula is visible and a red arrow is indicating that. So fistula means it's a fistulous communication. It would be apex of the piriform sinus to the thyroid, or cervical dermoid or epidermoid cyst, or floor of the mouth. These three findings would be there. So for the investigation is concerned, you can appreciate this through the fistulogram, and it will clear up as an brachial cleft fistula. Parathyroid cyst is not very uncommon, and it must also be included in the congenital cystic lesions of the neck, and this is basically a non-colloidal cyst near lower pole of the thyroid. So lower pole of the thyroid, mainly in the central part, usually you will be able to appreciate cystic protuberance in the neck in the midline. So here in this image, you can appreciate that in the central part of the neck, there is a protuberance, there is a cystic swelling. So this would be a parathyroid cyst. The best investigation for confirming the parathyroid cyst would be ultrasonography and ultrasound imaging. You can appreciate and differentiate between the thyroid cyst and the parathyroid cyst, and it can be easily distinguished. Cervical bronchogenic cyst should also be included in the congenital cystic lesions of the neck, and this is actually an anomalous foregut development, and it will also be in the center on the midline of the cervical region. So this is what the cervical bronchogenic cyst. So cervical bronchogenic cyst is the congenital anomaly. So in this images and this video, I have included the thyroglossal duct cyst, I have included a cystic hygroma, bronchial cleft cyst has been discussed, bronchial cleft fistula, parathyroid cyst, and cervical bronchogenic cyst has been discussed. Hope this would be worth watching and you will be easily recognized.